Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. COVID-19 has impacted the way we work, the way we go to school, the way we socialize with friends and family. It's truly changed the way we live. And many of us, especially people who are affected by MS, are wondering about what may come next. Joining us today to talk about where we are in the COVID-19 pandemic and what the future may hold for people living with MS is Dr. Nancy Sicotte. Dr. Sicotte is a professor and chair of the Department of Neurology at Cedars-Sinai Medical Center in Los Angeles. And Dr. Sicotte also chairs the MS Society's National Medical Advisory Committee and leads the COVID-19 Advisory Group. Welcome back, Dr. Sicotte. Thanks for joining us again today.
Thank you, John. Always a pleasure to be here with you.
For the past 2 years, COVID-19 has upended what many would call the normalcy of daily living. Experts seem to agree this virus isn't going away anytime soon, but there's hope that the COVID-19 vaccines and new treatment options will help us move from a pandemic to an endemic. So to get us started, I'm hoping you'll explain the difference between a pandemic and an endemic.
Yeah, so it is a little confusing, but a pandemic is typically associated with a novel infection, so something that no one has seen before that affects the whole world. So it started out, the COVID-19 started out as an epidemic in China, but then it spread to the rest of the world where it became a pandemic. So those infections over time, thankfully, pandemics don't last forever. Sometimes infections are eliminated completely, but more likely they become what we call endemic, meaning that they continue to persist, but only in localized areas. So instead of affecting the entire world, there'll be little pockets that we may see the virus poking up as we go forward. But living in an endemic infection situation would allow us to get back to a little bit more of our normal lives once the pandemic phase has passed. And I think we're getting close to that endemic kind of situation.
I was just going to ask you how COVID-19 becomes an endemic and how long that's going to take.
So it's an interesting question. And how long does it take to become endemic? I think what we saw, the Omicron variant seems to have speeded up this process because it swept across the globe. It infected so many people that we are starting to see this, what we had talked about before, this herd immunity. So when that happens, enough people have been infected or vaccinated that the virus can't take hold again and can't sweep through the population in large amounts, in large numbers as it had previously. But we know there are still people who are susceptible to the virus, that are vulnerable to getting infection, and there will be these pockets where the virus will live and sometimes flare up, and we'll probably have seasonal outbreaks the way we do with other kinds of viruses like the flu. We're not quite there yet, and how long will it take? I think it's still, We need to get more time behind us and more experience with what happens next. And we're hopeful that this winter surge will be followed by a much quieter spring and summer, fingers crossed.
Well, a moment ago, I heard you say that COVID-19 could become a seasonal virus like the flu. If that's going to be the case, what can we expect when it comes to things like mask wearing, boosters, and other prevention strategies that we've become familiar with?
Yeah, so I think we've been thinking about this a lot and talking about it on our task force for as well, because it's a bit of a psychological hurdle that I think we're all going to have to overcome. We're going to have to learn to have confidence in the strength of the vaccines and our ability to have access to treatments, which I know we're going to talk about as well. So we're going to have to build some confidence that we can manage these infections for the vast majority of people who are out there. But there are going to be people who have immunocompromised states and other risk factors who are going to really have to start managing some of those decisions about risk. So I think we're going to be living with masks for a while. I think it's become part of our security blanket, if you will, for some people. Other people can't wait to throw them off or have never worn them. And then boosters, I think, are in our future. What those will look like, I don't know. I think that we still have the risk of new variants being emerging. And so it may be that we need to have a whole new kind of vaccine booster for those, or the boosters that we've achieved so far with vaccination may protect us for several months or years. I think that's the piece, I think, that we still need to understand in order to feel confident that we're, can live in this endemic environment with the virus.
Well, I want to talk about some of those immunocompromised people you mentioned just a moment ago. We know COVID-19 vaccines are safe for people with MS and everyone should get vaccinated. But we also know that certain disease-modifying therapies may prevent some individuals from mounting an adequate immune response. So can you tell us which DMTs we're talking about here, and what does that mean for the people who take them?
Yeah, so this is an area that we've spent a lot of time, and there's a lot of interest in the MS community to really understand this so we can give good advice to our patients. So there are two classes of drugs that we use to treat MS that have been shown to result in a less robust vaccine response. And the first class are the B-cell depleters. So that includes medications like rituximab, ocrelizumab, and ofatumumab. And then the other class are the S1P inhibitors. So that's fingolimod, siponimod, ponesimod. And those classes of medications, when people are taking them and they get a vaccine, they don't produce as many antibodies as someone who's not taking those medications, those neutralizing antibodies. So it does make them have less protection against the virus. And we have seen some evidence of that, that people who are on those medications have a slightly higher risk of developing more severe infections. So this tells us that these individuals should exercise additional caution when they're out and about and among their family members and so forth. So they need to take those extra precautions because of this situation.
We heard from Chris. He has a simple question. Chris writes, why is it important to still get vaccinated if I won't have an immune response?
Yeah, so there's different immune responses. So the one that people are very focused on with the vaccines are these antibodies or neutralizing antibody responses. But it turns out that the immune system is also stimulated to raise other kinds of responses that are beneficial. And that includes what are called T cells, the T cell responses. Those are not typically measured, but we know from research projects that have been done that individuals, even when they're on these immunosuppressing medications, can also generate these T cells. And the T cells are really important in preventing severe disease. So we think the neutralizing antibodies prevent you sometimes from getting the virus, getting infected in the first place. but then the T cell responses are what keep you from getting very sick. And we see data now that supports this very much so, that people who've been vaccinated and boosted, even if they're on these other medications, do much better than people who haven't been vaccinated. So first and foremost, as we've said many times on this show, everyone who's listening should be sure that they are fully vaccinated and boosted at this time. That is the very, very best protection, and the data show that over and over again.
For people who are immunocompromised, the National MS Society guidance is that they should get a total of 4 doses if they initially received one of the mRNA vaccines, that is the vaccine from Pfizer or Moderna. Is that right?
It is, and it's confusing. And there's new language that's coming out that may unfortunately be even more confusing. But for immunocompromised patients, and this actually, the way the EAU was written applies to anyone with MS who's on a disease-modifying therapy, an immunomodulator or an immunosuppressant. What they say is that in order to be fully vaccinated for the first round, you need 3 shots. So that would be your initial vaccination. And then following that, 5 months after the 3rd shot, you would then be eligible to have a booster. And the booster would be for immunocompromised patients, would be a total of 4 shots to be fully vaccinated and boosted. For the rest of us, that would be 3 shots. So 2 for the initial series and then 1 booster afterward.
I also noticed that the MS Society is now recommending one of the mRNA vaccines over the Johnson & Johnson vaccine for people who are living with MS. What prompted that change?
So that was based on some data that showed individuals who had received the first J&J vaccine, when they were boosted with one of the mRNA vaccines, they had a bigger response. And then we also know that for some groups of patients, the J&J poses a slightly increased risk of things like blood clots. And that's in particular young women, which is a large part of our MS population. So that's why those recommendations were made.
We know that the COVID-19 vaccines are the best first defense against becoming infected. But now there are medications available to treat COVID-19 and medications to use before and after you're exposed to someone with COVID-19. Can you tell us what a monoclonal antibody treatment is?
Yeah, so monoclonal antibodies are these smart bombs, I think of them. They're highly selective proteins that are manufactured that then can be deployed under certain circumstances to have a very specific and beneficial effect. So we use monoclonal antibodies for treating our MS patients. Ocrelizumab is a monoclonal antibody. But in terms of COVID infections, one of the first treatments that was developed is the Regeneron monoclonal antibody infusion. And very famously, our previous president, for example, received that when he became infected. It turns out that that infusion is no longer recommended because it's been shown to be not to be effective against the Omicron variant. And the vast majority of infections that we see now are a result of the Omicron variant. But there are other monoclonal antibody therapeutics that have been developed. And one of them is called sotrovimab, which is a monoclonal antibody infusion. And this is given just a one-time dose for individuals who have mild to moderate symptoms associated with a COVID infection. The downside, I guess, is that these infusions are limited currently in terms of their availability. But I think this gives us something as we are thinking about the endemic stage, that we should feel more confident going forward that even if individuals do become infected, there will be therapeutics available that can decrease the severity of infection and decrease the likelihood of needing to be hospitalized or having severe COVID. So those are the 2 monoclonal antibodies that are available. And I think we're going to talk about the preventative, which is a different strategy, which is also a combination of monoclonal antibodies.
Right, I was about to ask about that. The FDA authorized the monoclonal antibody treatment to use as a preventative therapy after someone's been exposed to COVID-19. They authorized this use for people who are at high risk for severe COVID. Are all people with MS considered to be at risk for severe COVID-19?
Thankfully, no. And we know this from all the good data that was collected during this pandemic time. So the vast majority of people living with MS are no more or less likely to have severe COVID than the general population based on the fact that they have MS. The risks in those people are related to other underlying comorbidities such as diabetes, hypertension, obesity, underlying lung disease, for example. But for other individuals who are living with MS that have more severe disability and or taking some of the medications that we've talked about before, those are the individuals that really we want to keep an eye out for and might be good candidates for some of these so-called preventative therapies.
Oral antivirals are also available for treating COVID-19. Who should be receiving an oral antiviral?
So these are also exciting because they seem to be very effective. The supply is a little bit limited, and there are some interactions with other medications. But these are also indicated for people with mild to moderate disease and who would be at risk for having severe COVID. And so that includes the things that we talked about before with the comorbidities and then an underlying immunosuppressed state. But for an age is another factor. So that's, I think you're talking about the Paxlovid, which is the oral therapy, and the Molnupiravir, still struggling with these new names. Those are the antivirals. The Paxlovid seems to be the more effective. But these have been limited to access for people who are at risk for severe disease. And there are risk calculators that you can find online to determine if you are at risk for severe disease or not, based on your age and comorbidities and other factors.
Well, now that we actually have options in terms of potential treatment, how can someone with COVID-19 determine whether they should be receiving a monoclonal antibody infusion or an oral antiviral?
So that's a great question. And I think right now that depends on access. And then it would also depend on these other factors such as interactions with medications. So the Paxlovid interacts with a wide variety of medications, including anti-seizure medicines and so forth. So it may make more sense to be on one of the IV, like the Cedars-Sinai in that setting. But part of it will be determined by local guidelines and local availability of the therapies, at least for now. I'm hoping that as time goes on, we'll have a full panoply of treatments available for our patients.
Well, once the access challenge is solved, is there a preference between the monoclonal antibody infusions or the oral antivirals for people who are immunocompromised?
So I think we would want the immunocompromised folks to have access to the most effective of the orals, and that would be Paxlovid. But truthfully, at this time, I think it would be whatever is available in your area, and then whatever is going to be safe based on your own individual risks, including your other medications and other comorbidities.
We're beginning to see a shift in how people are thinking about COVID-19. It's starting to be considered more as a part of everyday life instead of something that requires lockdowns and very strict preventive measures. How will this shift in the public mindset and in public policy impact people who are immunocompromised?
So I think it raises, challenges for people who are immunocompromised living through this period. And I think we didn't talk explicitly about this other options that individuals who are very immunocompromised may have to give them that extra confidence and security to go out and start interacting in the world. And this was the preventative medication, or for people who have been exposed, which is called Evusheld. And this is a medication that for fully vaccinated people who are not thought to be able to mount a robust immune response, this is an option for people to get that has been shown to give added protection against the virus. So this, I think they use the shield in there like a shield. I think of this as an extra shield for our patients, so that they can go out in the world, and even though their immune response may not be as robust, they have this additional add-on. And that drug has been shown to be very effective in preventing infection, and certainly preventing severe infection. So I think it is going to be a nuanced, step-by-step process for people who are immunocompromised. And again, I think we need to go through some of these confidence building steps. We've been through this now with all of these surges where we think, normalcy is right around the corner. And I think we have to start managing our expectations that we're going to see incremental improvements, but not turning the page. It's going to be a slow process.
To that point, we heard from Lila, who says she's immunocompromised. And Lila says, hey, she's still living like the pandemic just started. She's wondering how long she has to remain vigilant and careful.
Yeah. So I think for Lila, this should prompt a conversation with her medical professionals and her physicians in terms of thinking about how to mitigate that risk. And again, everyone's risk is going to be different based on their underlying comorbidities. But I think first and foremost, anyone who's immunocompromised should be fully vaccinated. And then there is this option to consider having access to these medications such as Evusheld, as I said, to give you that extra layer of protection. But I just want to emphasize that individuals are not eligible for Evusheld until they become fully vaccinated. That is one of the priorities or the requirements of that medication, because it's not meant to be used instead of vaccination. And then I think, starting to get out in the world in a controlled situation and building confidence as we see cases drop, and to recognize that it may not be that you will never get infected with COVID, but that it will be a manageable short-term infection that you'll be able to recover from quickly and get on with life now that we have these vaccines and therapies.
Sometimes accessing the healthcare system can be a little challenging, if not confusing. Where exactly someone should start tends to be, sometimes it feels like a moving target. So suppose somebody who is living with MS, who may be on one of those medications where they're not expected to mount an adequate immune response to the COVID vaccine. They've been fully vaccinated, and now they want to, based on this conversation, perhaps they want to get that extra layer of protection. How do they access that treatment? Who do they talk to?
Yeah, so it's different at different places, but the first and foremost would be start with your neurologist, the person who's prescribed the medication that you're on that has resulted in your less than robust immune response. And then at each institution, there are policies that have been put in place. And I do want to emphasize that the amount of these medications is still limited. So for individuals who are looking to have access to them, just recognize the fact that supplies are limited, and there is a prioritization that includes individuals who've had solid organ transplants, people who are undergoing chemotherapy. But MS patients are on the list, and they should talk with their physician, their neurologist, and ask to be put on the list to have access to that. It may take some time, they may have to wait, but we're hopeful that the supplies will increase. And again, want to emphasize that for the most patients living with MS who are on those other disease-modifying therapies, there is not a feeling, there's no evidence that they would need necessarily this extra protection, as we talked about, unless they have other underlying comorbidities that are quite severe. And they may not be eligible at this time. So there is an eligibility criteria that they've developed.
Well, I want to thank you for sharing these important and very timely updates with us today, Dr. Sicotte. What would you say are the top 3 takeaways that you'd like our viewers to remember?
Well, Jon, my first takeaway is always get vaccinated and now get boosted. There is excellent data that you are going to be protected and you're going to have a much better, you're going to take this potentially life-threatening infection and turn it into annoying cold. So please, please, please go do that. Second thing is, I would want people to recognize there are therapies available if you do get sick, and for a certain subset of our population to maybe prevent you from getting very sick. So know that that's out there, and that should give you, I hope, some confidence. For the third takeaway, I would say is we're going to have to learn to live with this virus, and we want our patients to have the confidence to start engaging with the world again and starting to get back to a little bit more of a normal life.
Well, I want to thank everyone who submitted questions today, and thank you so much for being with us, Dr. Sicotte.
My pleasure. Thank you, John.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways for you to get involved, and upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Sicotte for joining us today. Please remember that a recording of this webinar will be available at the MS Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important, so you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Nancy Sicotte and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.